Hello, my friends. It's Dr. Sharon with Clinic Reviews. Today we're going to be talking about abuse and neglect. This falls under psychosocial integrity. Any kind of abuse is considered psych. That could be substance abuse, physical abuse, any type of abuse is considered psych. And then, of course, neglect falls in with that. So we're going to talk about both interventions and assessment. So let's go ahead and get started. Hello, my friends. It's Dr. Sharon with Clinic Reviews. We're so glad you are part of our Clinic Review family. You know that Mark Klimek is the GOAT of Nclex prep, in my opinion, and our Nclex review is the very best you can find in the entire universe, in my opinion. You can go to clinicreviews.com to sign up for our 21-plus hour Nclex review, our streaming service, which has all the videos you find here, plus more. And you can also sign up for our small group tutoring, and you can meet me live over Zoom for 2 of those small group tutoring sessions if you so choose. All right, let's go ahead and get started. A home health RN suspects abuse in several clients. Which situation requires the most immediate report to protective services? So, which one is at most risk for harm in the very near future? That's really what it's saying. An 82-year-old with poor hygiene lives with an adult daughter. Okay. Poor hygiene, I don't know that that's necessarily something that I think has an immediate risk. A 6-year-old with loop-shaped bruises on the buttocks that says, "I was bad." Okay, that one's worrisome. They have actual bruises that are suspicious looking, and they're indicating that at the current time they were bad. So I was bad. So I'm like, well, what's going to happen when you go home? Like, I'm worried about that one. Adult reporting emotional abuse by the partner says, "I'm safe tonight." Again, you have to believe what people tell you unless there's an indication that they're unreliable. There's no reason to think this person is unreliable, and they're saying they're safe, and it's emotional abuse, which is bad, but I'm not as concerned about the physical abuse at this very moment. A 16-year-old with a pierced eyebrow without parent knowledge. Okay, I don't know why I suspect abuse in that case. That just seems like a normal 16-year-old. Anyway, it's the 6-year-old that I'm most concerned about. They seem to be at greatest risk for immediate physical harm. Which chart entry is most appropriate when the nurse suspects domestic abuse? Client abused by spouse. Client states she is afraid of spouse. Client appears abused. Domestic violence suspected. All right, so when it comes to charting, you want to chart objective things. So domestic violence suspected is a subjective interpretation of the data. I don't know that I wouldn't say that at some point, but I'm looking for the most appropriate thing. And I'm looking for the most objective thing. If I can only choose one of these things, right? So most appropriate is best. So if I can only choose one thing, I'm going to choose the objective thing. Client appears abused. Now, that may seem objective to you, but it actually requires an interpretation of what you're seeing. So instead of saying they appear abused, I would rather say she has bruises here. She won't look me in the eye when she's talking to me. She's hesitant to answer questions when I ask her about her home life. Those are objective things, but to say that they appear abused is a subjective interpretation of the data. Client states she is afraid of spouse. Now that's an objective statement. I'm just reporting what she said. That's objective. On my part, it's a subjective statement on her part, but me reporting it is objective. I'm just reporting what she said. Client abused by spouse. Now, it doesn't say she said she's abused by her spouse. It just says client abused by spouse. So that, to me, is not appropriate for me to say client abused by spouse. Now, I could say client states she is abused by her spouse. That would be an objective statement. But I can't just say client abused by spouse without any data to back that up. So the correct answer is the objective statement. Client states she's afraid of the spouse. In a long-term care facility, an underweight older adult has dried food on their clothing and pressure injuries. What is the priority action? So if I'm thinking safety, because whenever someone's at risk to be harmed, I'm thinking safety. So what can I do to improve the safety of this patient? Provide snacks between meals. I guess I could do that. I don't know if that's the best thing. Educate the aide about hygiene. Maybe. I don't know that. I'm not sure that. The thing is, they have pressure injuries. They're underweight, and looks like they have poor hygiene with the dried food on their clothing. So providing snacks between meals addresses being underweight, and educating the aide about hygiene addresses the hygiene issue, but neither one of them are addressing the overall problem with what appears to be neglect. Ask family to bring preferred foods. Okay, that addresses the underweight. Notify the charge nurse. Okay, so notifying the charge nurse is addressing the bigger problem of abuse and neglect. So if we're concerned that there's abuse and neglect, what I would do is I would chart these findings, right? Underweight, they're underweight, they have dried food on their clothing, here's their pressure, where their pressure ulcer is. I've notified the charge nurse according to chain of command. According to chain of command, you always follow chain of command. This is a legal issue. We're obligated to report suspected abuse, and so I have to notify the charge nurse. A 3-year-old presents with a spiral humeral fracture. So whenever you see a spiral fractures, I'm not an expert at this, but it seems like spiral fractures are always associated with potential abuse in children, like shaking, I think, tends to be spiral fractures, or maybe not, I don't know if it's shaking, but it's something related to that. Parent says she fell off the couch. What should the nurse do? So I have the statement by the parent that doesn't seem to be consistent with the injury. So what should I do? So I can report it to Child Protective Services. That's, if I suspect abuse, that's what I have to do. Let's see what the options are. Obtain a comprehensive history and physical assessment. All right, that seems like a good idea. I don't have a lot of information. She presents with a spiral humeral fracture. His parents say this happened. It's not consistent with the injury, so do it. That seems okay. Do further assessment. That's fine. I can do that. Confront the parent about possible abuse. All right, that's not appropriate. If we suspect abuse, we have to report it. We don't confront the parent with it because it's illegal. And with something being illegal, we have to report it to the proper authority following the chain of command. Discharge with safety teaching. No, I don't want to do that because I'm concerned that the injury isn't consistent with the story. Ask the parent to demonstrate lifting technique. Okay, I don't know why I would do that. 3-year-old, no, I don't know why I would do that. The only one here that makes any sense is to obtain a comprehensive history and physical assessment. Now, if instead of that it had said report to Child Protective Services per protocol, then I would do that because I'm obligated to report if I'm suspicious, just suspicious. I don't even have to be for sure, but if I'm suspicious, I'm a legally obligated reporter of that. A sexual assault survivor arrives within 2 hours of the event. Okay, so they just experienced the event. Which instruction is most important before evidence collection? So which instruction is most important before evidence collection? So most important is best, which means I can only do one thing. So starting IV fluids is most important before evidence collection. I don't know why. They haven't given me any evidence that they're dehydrated, so I don't know why I would do that. Avoid showering or changing clothes is most important before evidence collection. Now that is true. Because if you're going to collect evidence, it's specific to evidence collection, they can't shower off the evidence. So B is a good answer. Performing a comprehensive assessment is most important before evidence collection. Well, actually, evidence collection will involve a comprehensive assessment. So you don't have to do a comprehensive assessment before evidence collection because evidence collection involves this comprehensive assessment. It's most important before evidence collection to ask if the client wants to call a partner for support. Okay, I like that answer. That's important, I think, to see if there's somebody they want to call. However, If I can only do one thing, if I ask them if they want to call their partner, but I don't tell them to not shower or change clothes, which means they're showering and changing clothes, but they're calling their partner, or they're not calling their partner and we're not showering and changing clothes. We have to avoid showering or changing clothes. Like we have to, because that's related to evidence collection. Okay. If this were like a psychosocial question, and what's most therapeutic, I mean, asking if they want to call someone for support is probably most therapeutic, but this isn't a most therapeutic question. It's about evidence collection. Which comment from a caregiver of a bedbound parent is most concerning? Caregiver of a bedbound parent is most concerning. All right, let's see what the answers are. I'm exhausted and need respite. Okay, so that's concerning in that I probably need to take some kind of action to help the caregiver. I feel guilty leaving the house. All right, that's concerning, and then I probably need to deal with the caregiver. We're learning proper turning techniques. Okay, that's good. I'm glad they're doing that. That's not really concerning. Sometimes I don't give her water when she's rude. Okay, so that's not good. So we have two answers where there's a psych issue for the caregiver. A and B are psychological, and maybe slightly if she's exhausted, but they're subjective. They're subjective. And A and B are both subjective problems with the caregiver, whereas D is a objective report of neglect. Okay, she's actually reporting neglect because water isn't something you can withhold. Like, I mean, if she says, I just don't respond to her rudeness when she's rude, okay, fine. You can walk away when someone's rude, but you don't withhold necessary things. I mean, she is the caregiver for their parent. That's a choice they've made. That's a neglectful, potentially abusive kind of a situation. After a stillbirth, the parents asked to hold their baby. What is the best response? So if you don't know this, that's okay for the parent to ask to hold their baby. It helps with grieving. And so this is okay for them to do that. So what's the best response? So really, what's the most therapeutic response? That may be too upsetting right now. No, we don't say that. No, the parent wants to hold their baby as part of the grieving process because they're in shock and they need to like process through what happened and see that the baby is actually, quite frankly, not alive, right? They need to like know that so they don't constantly question that. B, it's better to remember the baby as you imagined. No, that's actually not a true statement. C, yes, we can give you the time together in private. That's what you would say. Yes, that's exactly what you would say. We must transfer the body. D, we must transfer the body immediately. We don't have to do that. We can give them time. So what we do is we clean the baby off very well, just like any post-mortem care. You clean the body and you cover it in clean linens. And then, like, if it's an older adult, you let the family come in and see them. If it's a baby, you wrap them up and let mom hold baby. A family member of a hospice client says, if we start morphine, we're killing him. What's the best response? Okay, so this is a concern that the family member doesn't understand the purpose of morphine in a hospice situation. So they don't understand it. So let's see what the answers are. Morphine will control the pain. That's generally true. I don't know that I would be that definitive with that statement, but it is generally true that morphine will control the pain. Are you saying you don't want us to use morphine? All right, that's a clarification question. Clarification questions are good. Sort of a reflection clarification question. So, because you don't know why they're saying that. I don't know why they're saying that. So you saying you don't want us to use morphine, it doesn't mean that I'm not going to give them morphine. It just means I'm trying to clarify what they're saying to me. C, we'll start it anyway because the doctor ordered it. All right, that's disregarding the family member's concern. So I'm not going to say that. You don't just say, well, the doctor ordered it, so I'm going to do it. Like, that's just not therapeutic. You're overreacting. Okay, that's not therapeutic at all. No, don't say that. C and D are out. So we're really looking for the most therapeutic response. So being therapeutic, sort of generally therapeutic, is usually getting the person to talk more, or reflection, clarification, open-ended questions. These are all things that are therapeutic in general situations. There are some specific types of therapeutic confrontation in, say, denial. That's what you can do there. But in this case, we just want to generally be therapeutic. So we want to clarify here. Are you? This is what I hear you saying. Is that what you're saying to me? So yeah, that's a good answer. A nurse suspects child abuse, but the provider disagrees and plans discharge. What's the best nursing action? Okay, that's so you don't just go, okay, fine, I guess I told the provider, okay, the provider is not line of authority. The provider has a role and we have a role, but they're not our direct supervisor. So if we suspect abuse, we have to follow the chain of command and follow the protocol for reporting suspected child abuse, elder abuse, whatever kind of abuse, and telling the physician is not chain of command. They are not in our chain of command. And this is an illegal activity. So I have to follow the chain of command in the hospital protocol. Activate the chain of command and contact Child Protective Services. That sounds like a good idea. B, discharge the family and document the concerns. No, no, that's not right. C, call security to detain them. Absolutely not. You don't call security to detain the family. D, confront the provider. No, don't confront the provider. That's not our role. We don't confront the provider about this. We just do what is correct according to our scope of practice and the policies of the hospital. So we activate the chain of command and contact Child Protective Services. Okay, well, I hope that was helpful to you. And I enjoy reading the comments that you give me for these. And I hope you have a great rest of your day. And I'll see you again next video. Take care.